Welcome back. It is Monday, and that means a visit with our Channel 4 experts from East Cooper Medical Center. And today we are discussing BRCA genetic testing that seeks to identify people who may be at risk for certain breast or ovarian cancers. And Dr. Natalie Gregory joins us along with her patient, Bree Warden. Welcome to the show, ladies.
Thank you.
Now let's talk about this because it's something that we've addressed quite often here on Low Country Live. And I think really more so now there's an awareness now that Angelina Jolie came out, and that's how she found out she had a BRCA done. So tell us, who should be screened for this?
Well, we're really looking for people that their family has a cluster of cancers. Okay. So not every woman needs this testing. Okay. But if you have a family history, maybe you've had people diagnosed at a young age, younger than 50, or you've had somebody, a male in your family, diagnosed with breast cancer. If you've had somebody diagnosed with 2 different breast cancers, or ovarian cancer too, and this can be on the mom's side or the dad's side. So we really want to encourage people to get their family histories, find out who had what, mom's side and dad's side, and how old were they when they had those diseases.
Happened. Now, of course, if someone tests positive, I saw where it's either you test positive for BRCA1 or BRCA2. Can you tell us about that and the difference between the two?
Sure. So depending on whether it's BRCA1 or BRCA2, we can actually calculate what is your 10-year risk and what is your lifetime risk of developing breast cancer. And there's a little bit different risks for ovarian cancer. For example, with the BRCA2, your risk of ovarian cancer is a little bit higher. But we basically, whenever we get a positive result, we would sit down with the patient and say, okay, where do we go from here? What does this mean? We're empowered by this new information. And we can hopefully prevent you from going down the same road that your family member went
Absolutely.
down.
And Bree, and that's where we turn to you now. What prompted you to get tested?
Just what Natalie said. My mother's first diagnosis was in her 30s with breast cancer, and then she passed away at 50 having breast cancer again. So I decided to get genetically tested because she had done everything right, and I just wanted to see if I was at an increased risk as well of having breast cancer, and if there was anything I could do to avoid it.
Yeah, and that test, it came back positive?
Came back positive.
At what age?
I was 19 then.
Oh my goodness.
I was 19, but again, I felt like I just wanted to find out. I wanted to know exactly what my plan was. I felt like the more information I had, the better. So I started just doing clinical breast exams with my OBGYN every 6 months then. And then at 25, that was their recommendation to have my first mammogram. And on the very first mammogram, I did have a spot. So I had a biopsy, and at that point in time, we had a decision to make.
And what was your decision?
My decision was just like Miss Jolie, I said a prophylactic bilateral mastectomy.
Yeah.
So I had that done, and that decreased my chance of breast cancer from
by a great deal. Yeah. How much?
From 87% down to less than 5%.
My, okay, that is awesome. Now, so what do you do next now that that's done? Doctor, do you continue to monitor her for anything else? Is she out of the woods, so to speak, even though her percentage is down to 5%?
Well, that's great that her percentage is down to 5%, but we just said that this is for ovarian cancer and for breast cancer, so they run together.
So now you have to continue to monitor her for the ovarian cancer.
Absolutely.
Wow.
Absolutely.
Okay, now what are the options for women who are at higher risk now?
Well, there are lots of options. So Bree kind of told you a little bit about her story and how she came to those decisions. If you're 19 and you get that information, what you're going to be doing may be totally different than what you would do at 40 years old. So what this means for people is it can be something only just additional breast exams or additional ultrasounds of your ovaries and some blood tests. It could be MRIs and mammograms. It could be taking medications that can decrease your risk. And then the most extreme and also the most effective is surgery. But I don't want people to think that if you get back this result and it's a bad result or it's a positive result, that your doctor is going to say you have to have your breasts and your ovaries removed. That is absolutely not the case. That is what some women would choose to do depending on their risks and their family history and what they want for their life.
All right, and with that said, if you know your family's history and you know the risk, do get that genetic testing done. Dr. Gregory and Bree, thank you so much for sharing your story.
Thank you
for coming.
Thank you.
All righty, stay with us. We'll be right back.